We met when you were in your postpartum period, and there had been
It was 2 years post birth,
a
but as
bit,
we know,
yes,
for
but
me,
there
my
was
postpartum period was long.
postpartum problems were still presenting. Well, that's a lot of P words.
Postpartum problems were presenting.
Yes, even 2 years after your birth. I remember there was diastasis.
That's right.
And there had been some problems with a tear, a 4th-degree tear that had gone all the way back to the posterior anal wall.
Yeah, I was pooping in my pants without knowing it. I feel like it's important to use my own personal experience to help other women, because all of these things, most of the time when women come to me, that's mostly what they're feeling, is they're feeling like something is wrong with them.
Yes.
And they're abnormal, and that they're damaged.
Yes.
And that they may never be normal again.
Well, I remember these were things that you said to me in our intake. I feel abnormal, I feel damaged, I feel as if my body will never ever go back to its pre-birth configuration or the sense that you had prior to your childbirth experience. And I remember doing some work, deep internal work, climbing my fingers up inside and behind the pubic bone, which is the attachment site for the linea alba, the connective tissue cord that stretches from the sternum to the pubic bone. And the abdominal muscle should be connected to that linea alba. And I wasn't even thinking about that. I was looking for, following my fingers as they were saying, oh, there's tightness here, oh, there's an adhesion over there. I need to see, I was exploring, mapping essentially the area behind the pubic bone. And I remember you communicating with me very soon afterwards that your diastasis had closed.
That's
and
right.
I was like, but I didn't,
It
how could that happen?
It shocked both of us, because when people talk about diastasis or diastasis, it's like you have to have these like 6-week protocols and bind your belly and do these breathing exercises. And here we got in the territory, and in one session, from that presence, it knit completely back together. Just to complete my personal story, like my diastasis re-knitted. I didn't have painful sex anymore. My scar tissue softened up, and the entrance that was completely misshapen from how it was originally reshaped, and then my hemorrhoids reabsorbed, and I didn't have the fecal incontinence anymore. And I wasn't really sure if I had a full-on sphincter tear or nerve damage, and I wasn't sure how the involuntary and the voluntary were going to work together. And here I was coming from this point of view of being a real pelvic floor nerd before that. Like I was kind of an expert before I had this happen to me, but I really had to live through this whole process to arrive here and to discover these modalities that I hadn't investigated before, and now that we know are so effective in helping women resolve things that cause years and years and years of pain and problems in relationship and marriage and bonding and happiness and all kinds of things that we can help in a few sessions when the field is primed, when the territory is in the right, let's say the soil is in the right space for those patterns to be looked at, and
reconfiguration to occur.
That's
actually.
Right.
Yeah, reconfiguration is possible.
It's possible, non-surgically.